President Trump and congressional Republicans have tried to kill the Affordable Care Act more than once this year. But the legislation, also known as Obamacare, is still the law of the land despite their best efforts. This means that you'll still have to pay a penalty when you file your income taxes next April if you don't have health insurance coverage throughout 2017. Hector de la Torre, executive director of the Transamerica Center for Health Studies, says consumers still need to pay attention to the tax filing regulations of Obamacare, at least until or if Congress manages to kill it. The Affordable Care Act is still current law as of today, de la Torre says. Unless Congress approves changes and the president signs that legislation, the mandate is in effect. The president's recent executive orders direct governmental agencies to draft new regulations. However, those have not yet been drafted, and that process takes months. There is one significant change, though, from last year. You no longer have to answer questions about your health coverage on your tax return. In the past, the IRS would not accept any tax return that didn't provide health insurance information. The 2017 tax return, though, will allow you not disclose if you lacked health insurance. One of the more controversial elements of Obamacare, and one that Trump and his fellow Republicans have criticized, is the requirement that individuals must buy health insurance or pay a penalty when they file their taxes. This individual mandate is necessary, though, for Obamacare to work. When healthy individuals buy health insurance, it spreads out the risk that insurers face and helps keep premiums affordable. The challenge, though, is that Obamacare premiums, which already rose in 2017, might not be so affordable to everyone next year. That's because premiums are expected to rise again in 2018. Healthcare consulting firm Avalier studied initial rate projections from 8 states and found that the premiums for Silver plans, which are the program's most popular, are expected to jump 18% in 2018. That comes after the premiums for those plans increased 12% in 2017. Related, what effect will Trump have on women's health care? Some states might see especially steep increases. According to an October 2017 story by New York Magazine, consumers who take out individual insurance through Obamacare in Florida could see an average premium increase of 45%. In Georgia, according to the same story, premium hikes might soar to 50%. Consumers might also have limited options when it comes to Obamacare. Avalier says that 41% of U.S. counties are expected to offer just one insurer on the Obamacare marketplace in 2018. U.S. residents who can afford health insurance and don't sign up for a policy will face a penalty of either $695 per adult plus $347.50 for every child, or 2.5% of your household income minus the amount of the minimum filing threshold, the lowest income at which you need to file taxes, whichever amount is higher. The highest you can pay in penalties, though, is $2,085, which is equal to the average annual premium for a bronze-level health insurance plan sold on the Affordable Care Act marketplace. Stephen Cruz, president of Resolve, Inc., a consulting firm based in Washington, D.C., says that these penalties can make a significant dent in the yearly incomes of some taxpayers. The basic fact is that there will be a high cost to gaps in insurance that folks need to be prepared to face, Cruz says. How much you'll pay depends on your family and your income. First, figure out the flat dollar amount. If you and your spouse don't have health insurance this year, you'd pay $1,390 in combined penalties on tax day in 2018. If you have children who are also uninsured, that fee would be higher. Say you have 1 child, the fee for all 3 residents of your household would be $1,737.50. Next, determine how much you'd have to pay using the income formula. Take your household income minus the minimum filing threshold amount for the year, the income above which the IRS requires you to file income taxes. The most recent number available is $10,350 for a single person under the age of 65 and $20,700 for a married couple filing jointly. Calculate 2.5% of that number to get a total that you'll have to pay in penalties. Finally, compare your flat dollar total to your income formula total. The larger number is your Obamacare penalty. Check out 10 ways to lower your healthcare costs. Calculating the penalty can get more complicated depending on whether you didn't have health insurance for only a portion of the year. If you are without health insurance for only 1 or 2 months, you won't have to pay any penalty. But if you lacked coverage for more than 2 months in a row, you will face a penalty. If you had insurance for some of the year, you'll pay your penalty on a prorated basis for the months in which you didn't have health insurance. To figure your penalty in this case, take the total penalty amount you'd owe for the year if you had no insurance at all. Divide that number by 12. Then multiply that amount by the number of months you weren't covered. And remember this, if you had insurance for even one day in a month, the federal government will consider you covered for that entire month. In more good news, you might not have to pay your Obamacare penalty even if you